Good evening, everyone. Sherry here from Pre-Dental Universe, and we would like to welcome Dr. Wheeler for being here with us tonight. And we're very happy to learn from her journey. And without any further ado, please feel free to get started.
All right. Hello, everyone. I am Monica Wheeler. I am a general dentist. I'm in private practice in Raleigh, North Carolina. I am trying to share my screen and talk to you at the same time. So please forgive me for looking down. Don't get a new phone right before you're doing a Zoom call. I also, my disclaimer, I have a 4-year-old who is asking for French fries, so you may hear her laughter or something in the background. So just ignore that. So I kind of wanted to start off by talking to you guys about what I do as a general dentist. I will just share a screen. This is kind of my daily, what I am working with on a daily basis. So background information, I'm originally from New Orleans, Louisiana. I went to college at Dillard University. I went to dental school at Meharry Medical College. And then I did a 1-year residency in Morristown, New Jersey at Morristown Medical Center there. From there, I went to private practice and lived in Nashville, where I went to dental school after residency for a few years and then moved to North Carolina. I became sedation certified in 2017. And it's a huge game changer for the way that I would like to practice dentistry, what I can provide for my patients as far as comprehensive care. The residency program that I attended did focus on all aspects of dentistry. So we had pediatric dentistry, perio, oral surgery. We took patients to the OR for general anesthesia to do, like full mouth rehab. We did lots of oral surgery. It was a very comprehensive residency program. So I know this is kind of early because I think you guys are all pre-dental, but when you are in dental school, you want to, you'll get to the point where you want to be looking at where you want to go. If you want to do a residency, it's not required, but it's a great way to get out there and learn more things. Dentistry is about lifelong learning. So I always tell people you will be a lifetime student because there's always, just like advances in technology, there will be advances in dentistry and medicine and everything that you do. You want to be on the cutting edge of things. You don't want to be like behind the 8 ball. So it's always important for you to do continuing education courses. Most states that you reside in require a certain number of hours per year to maintain your dental license. So that's an important aspect that you may not know. But at any rate, back to the IV sedation, it was a separate certification that I did to provide the service to my patients. It's conscious sedation, so patients have full control of their airway, meaning they can breathe on their own. But basically, the drugs we are using is Versed and fentanyl, and sometimes some other drugs. Those are the 2 main drugs. They kind of provide a twilight sleep for a patient, so they don't remember what's happened from the time we give them medicine until the next day. So it's great because patients will complain about if they're getting a tooth extraction or a wisdom teeth extraction, this is really good for. But basically high fear patients, which there are a lot of in society. So mostly when you're doing IV sedation, you think about, okay, well, what people are afraid to go to the dentist. It's those patients who've been away for a long time. So usually the cases that I'm doing are bigger, like full mouth comprehensive care to patients. So either, full mouth extractions for dentures, implants, wisdom teeth, cosmetic procedures also. A lot of patients want to just wake up and be, a lot better than when they started out. So those are all things that we utilize IV sedation for. So this is kind of my setup. I showed you on the screen. We have a monitor here. Obviously, you don't see my patient, but we have oxygen. We have reversal meds. We have everything that we need to provide the patient with the safest treatment and the most comfortable treatment. I will share another one of my cases that I worked on here. Just one second. So as I was saying, a lot of patients, one of the things that we do the most is taking out wisdom teeth. I think most people think you have to be an oral surgeon to take out wisdom teeth, but there are a lot of wisdom teeth that you can take out if you have a certain skill set. So just like with IV sedation, I did extensive training on implants, wisdom teeth removal, cosmetic cases. So I have over about 500 hours of continuing education, which is kind of where you want to be if you're doing really good dentistry. So I will just show you, also not related to sedation, but cool things that you can do as a general dentist. You can always provide your patients with the ability to get orthodontic treatment. You don't have to be an orthodontist. You just have to do extended training. So here you see a patient who came in. Her before picture is the top picture. She had a tooth crowded out of her arch. There, we did braces on her. With the treatment is called 6 month smiles. Got her tooth in the arch, and she's super happy with her result. And she didn't have to see a specialist. A lot of times, patients don't really want to see a different doctor, is what we find. Once they get really comfortable with someone, they kind of tend to like to stay with that provider for a long time. Another case here, which the pictures are not very perfect, but I'll show you some of the cool ones where we did some extractions here. So I kind of like to take a lot of pictures of my work. There. At any rate, so these are some wisdom teeth extractions that I did here. The wisdom teeth are the very last teeth on top and bottom. Same on the other side. When I take the teeth out, I usually like to get a quick photo of them. I'm sure you've seen lots of people on Instagram that have showed pictures of their teeth coming out, and they kind of look like this. We always have all the information for patients, their name. Obviously, you can't see the patient's name, but what medical issues do they have? That's important. Also, what's like their blood pressure, you need to know those types of things because you're giving them anesthetic, and most of the time it has epinephrine in it. That speeds up the heart rate, increases the blood pressure. If you have a high blood pressure, you have an increased chance for the patient to have a lot of bleeding when you're taking a tooth. So you're actually removing a body part. You don't want to have so much bleeding that it puts the patient in danger, and that is something that can happen. So here are the 4 wisdom teeth. If these were all in the gums, not in the oral cavity, but this is what they look like when they come out in one piece. Sometimes they do, sometimes they don't. But with IV sedation, we probably got these teeth out in about 10 minutes or so. So that is the beauty of IV sedation, and patients are comfortable, happy, stressed. The staff is low stress because the patient is sedated and they're happy. Because most patients don't want to see the dentist, and the fact that we can provide those services to the patient, and they're also getting their cleanings in our office, they're getting their fillings done, their crowns done in our office. They already know us, they're already comfortable, so they're like, yes, take my teeth out, take my wisdom teeth out. I'm so happy to be here. And that's one really cool thing about doing sedation dentistry. You really have the ability to do comprehensive care on your patient. A very, very cool thing to provide to your patients. Here's another case that I did, kind of full mouth work on the patient. The patient had not been in a while, but we always have a list of things that we're going to do. So the top portion just shows what crowns we did, what you see maybe on Instagram or some other platforms is people who have veneers or have a cosmetic change to their tooth. A crown kind of provides the same thing. So this patient had crowns on a lot of her top teeth, kind of the ones in the smile zone, that's 4 through 13. And then the bottom half of the middle says we did her cleaning. The bottom half of the sheet is the teeth that we took out. We did some grafting. So we took the teeth out, placed some grafting material, and we came back and placed implants later. Patient had a really, really beautiful result with everything, but she was so afraid, and she had stayed away from the dentist so long. She had a lot of cavities in her mouth. So these are the types of things that you get to do when you do IV sedation, which is very cool, because then you can literally have like one case for the day. You've already, gone way over your goal for the day, and you can just kind of relax it. Everything is low stress. Everybody's safe. Everybody's comfortable. You're working at a good pace. You don't have to run around doing 50 million appointments. So it's a really, really good procedure to provide to your patients. I will share a few other cases that are pretty cool. So I guess I can talk a little bit now about, here, I'll just show this picture. So the top is some of the crowns that we placed on a patient. This patient was sedated. You see the gauze in her mouth because we put a throat pack in, because crowns are little, just like teeth, so they can go down the airway. We don't want that, so we want to make sure our patient is safe. So we always want to place a throat pack there. The little blue things on her teeth are just some bite stops to kind of open her bite up just a little bit so she can have room for her crowns. And patient, again, was very, very happy with what she had going on. I did want to talk to you guys about studying for DAT. Everyone should be studying for that, right, Sherry? Okay. I'll share a couple other cases, and then I'll talk about some recommendations I have. This is a patient who obviously has some neglect. We can see that he just has some really broken down teeth. You can look at his lower teeth and see that he hadn't had a cleaning in a long time. So we sedated him, and he had a really good result. Not super perfect, because again, we were just meeting this patient. A lot of times the patient comes in and they want treatment the same day because they don't think that they will be able to come back. So you can see here, obviously, this is when he was sedated. Again, the gauze is in his mouth to protect his airway, because those little temporary teeth can come out. And there's his nasal cannula that basically just goes into the nose, provides oxygen to the patient. So it is a supplement if anything happens, because obviously, you're learning all your chemistries and biologies. All the different medicines you give to the patient affects the different parts of the bodies different ways. So the medicines that we use for sedation can lower the respiratory efficacy of the patient. And so it's very, very important that they have the appropriate levels of oxygenation. Let me see. I have a few other really cool cases to show you guys. This is like kind of a little non-related, but this is a during a root canal procedure, you will see this blue thing. It's called a rubber dam. It basically provides isolation for the teeth. So this is how teeth look when they are prepped. This looks like an old picture. But when you take a nerve out of a tooth, if you have not seen it, and I hope you guys have eaten your dinner, because this picture is a little bit, may make you feel a certain way. But this is the nerve of the tooth. This is exactly how it looks. It's pretty cool, but it's the thin little ribbon-like part of your tooth. You can sometimes get it out in one piece, sometimes you can't. But I did, and I was like, this is a cool picture, cool thing to see. Let's see. I did have a PowerPoint with all these things in it, but I cannot access it, so this is what we get. Another patient of mine had a lot of wear on her teeth. So if you look on the back teeth, you can see kind of the circles in the teeth. Those are, we call those wear facets. Basically, it means that some of the tooth structure has been worn down over time from grinding or clenching the teeth. So obviously this patient needed full crowns. She needed full coverage crowns on all of her teeth. And our result was something like this, where she had all of her teeth crowned. This is mid-procedure here. The holes in the teeth on this picture just kind of shows which teeth needed root canals. The little clear contraption that's in her mouth is kind of protecting her airway also. You can see it laying against the back of the throat and kind of also retracting her cheek. That is a very cool device, really, really good for sedation, for protecting the airway again, like I said. Here is how her teeth look once we cleaned everything up. So that's a lot cleaner. She still has a lot of bleeding gums and things like that. And this is her final result. That's your final result. Well, this is how she came in, how she presented into the office. So she had a lot of obviously broken down teeth, a lot of years of neglect, and she just was very afraid. She had a bad experience with a dentist. So this is kind of will segue into what I'm going to talk about next. But she had a dentist who was not nice to her, and they didn't listen to her. They didn't listen to her when she said she was in pain. They weren't friendly, they weren't welcoming. So when we think about being providers, healthcare providers, we always want to provide a safe, comfortable, healthy environment for a patient to communicate with us. You know, most of the time, if you've had any dental work done, you can't see anything that the dentist is doing. You're trusting them 100%. So you always want to make sure that you're developing your personality to be a great communicator, a great listener, and just be very empathetic to people and, you know, what their needs are, you know, expressing themselves or telling us when they're in pain, or just establishing the rapport with the patient that they can trust us enough to say, hey, like, I'm really scared about this, you know. And if you haven't had any dental work done, you know, I really would recommend going to shadow or sitting with someone, you know, who's having dental treatment, or getting it yourself and put yourself into the patient's shoes. It's kind of an uncomfortable thing. So in developing our personalities for school, we were talking about the interview process. You know, interview committees are going to be looking for people who can communicate great, who they feel comfortable with. Those are the providers they want to, you know, create in their school. It's not just the person who has like the best scores on every single thing. That's important, but are you able to make eye contact? Are you able to be comfortable communicating with people? Are you able to be a listener? Are you, you know, all those soft skills are very, very important in healthcare. Otherwise, you might not have a lot of patience. So I will show you the patients. These were her temporaries, and she was really happy with it. Kind of just changed her confidence level. So sorry there. You can see very beautiful result that she had. Obviously, she was able to smile and speak again to people. She came back later, about a month later or so, and got all the lower teeth crowned. But obviously, with sedation, she was very comfortable. She was very happy. And then she sent her mom in to get all of the same treatment too. So you actually think about what the skill provides you not just the ability to change lives and help people overcome their anxiety, but you also can make a lot of money, because this was probably like maybe a $40,000 case or so. So that's not all. You don't take home all of that. Obviously, dental insurance does not help with these types of things, but there is a market of patients that want this type of treatment, and they want to just wake up and be different, look different, and have an amazing result there. Hopefully this is not annoying too many people, me going back and forth. These were the patient's crowns before we put them in her mouth. So you can just see how many crowns she had there. And they're very beautiful crowns. But yeah, great patient, great case, very, very fun. We have root canal procedures that we do also. So here is a tooth that obviously has a big cavity. You see the hole in the tooth. Usually the bad stuff shows up as gray, and the filling materials kind of show up as white. So this patient had a cavity around her existing filling. Was in pain, obviously. She doesn't look like she has any other teeth around it, so we definitely want to save the tooth that has a good amount of bone around it. So we did a root canal. A root canal is actually called root canal therapy. It extends the life of the tooth so that you can keep the tooth longer. Usually root canals can last at least 5 years, but you're aiming for 10 to 15, maybe 20 years. But this is the root canal done on this tooth. Basically, root canal therapy is going inside the tooth, removing the nerve, debriding the canals, sterilizing them, and putting a sterile filling material in, which is the white you see all the way from the top of the tooth down to the end. At the very bottom of this x-ray, you can see that grayish area. That's actually one of the nerve canals. This, as a reminder, this is a 2-dimensional picture of a 3-dimensional item, right? So you think about the perceptual ability and how that ties into what you're doing on a daily basis. A lot of your images are kind of just pressed. They're just 2D images. So, when you get into a tooth, if it's a 2-dimensional image of it, the objects are going to be actually closer together when you get into the tooth. So you tie that perceptual ability that you're learning for the DAT into this. I think it's kind of cool to kind of know that. Also, perceptual ability is using your mind's eye to figure out things, right? So it would be really cool if we could take a tooth out of the mouth and do the root canal in it and then put it back in the mouth, but it's not. And we don't know where the canals are inside the tooth. When we are looking at the tooth, we have a general idea, but we don't really know. We're using our mind's eye, which is what you're training your mind's eye to do with perceptual ability. So that you can do a procedure like this, like a root canal, because that tooth has 4 canals, although you can't see it on this image because it's only 2-dimensional. You have to be able to shift the x-ray so that you can get a view of the way the 4 different canals look on the 2-dimensional object, and seeing how long is this canal, how short is this canal. So those things all kind of tie into what you do as a dentist on a daily basis, to be honest with you. So hopefully that kind of can help, because I know the perceptibility can be sometimes frustrating for people. I know that there is a dental boot camp. I think it's like maybe an app or something. They have like those brain teasers or perceptual ability games. I have 2 pre-dental students that I'm mentoring now. They come on Tuesdays and Thursdays, so we're always like playing those little games all together. Everybody in the office. So let's see if I have any more pictures, and then we'll just kind of chat about what I would recommend for what you guys have going on. These are some cool ones. Wisdom teeth here, pretty cool. So again, where perceptual ability will allow you to, you can't see all of this anatomy on just a two-dimensional panoramic x-ray. You'll see a little bit of it, but there's, on the tooth on the left, there's a root coming out kind of up towards you. The roots are bent. You also have to know physics because you need to know where to apply what force to the tooth. Everything just kind of ties in together. So just know that what you're doing now, you're learning the basics and you're building. Once you get into dental school, you'll be building on the different foundations from now to when you become a dentist. So I will share one more picture and then I will just kind of chat with you guys about what you could be doing. Not that you need all of the information. Here's another orthodontic case that we treated here. Patient was just an older guy and he didn't have the ability to get braces when he was younger, had like a lot of siblings. His parents couldn't afford dentistry. And so he came into our office. We do Invisalign, 6-month smiles, things like that, based on the patient's case. Everybody's not a case for Invisalign or a candidate, but this is what he left with. This took about maybe 3 or 4 months to achieve. And he was just so happy. He had a whole different level of confidence. But these are the things that you can provide for your patients. So hopefully that's exciting to someone to see. And then I will leave some pretty crowns up there and chat with you guys about a few things. So when you are doing work, you're doing, let's see. There we go. When you're doing dentistry, you're always going to be communicating with a lab technician unless you are designing all of your cases in-house, in your office, which is not the case all the time. But this is actually a 1-unit bridge for a patient. She had her front 2 teeth taken out, but obviously here you can't see that. And this is what we're aiming for, something natural that no one knows that this patient is missing her 2 front teeth. We wouldn't be able to tell unless I told you that. So that is that for my cases. If anybody wants to contact me about anything, my email is Monica S as in Sam Wheeler @gmail.com. My Instagram is the classic Dr. Monica @gmail.com. I don't post a lot of dental things on the posts, but in the stories I do. And then I have another page called Dentistry by Dr. Monica, and that one has more dental things on there. So let's talk about, you guys are probably studying for DAT, possibly. I always say that the best thing that you can do is make a schedule, take a practice test, see where you absolutely are doing the worst, make that thing what you focus on the most because you want to master that. And then every day, every week you want to study something different, or however many days you feel like you need to study like the different subjects. But every single day you want to do as many questions as you can. I always say perceptual ability is something that you can train your mind to do. And if you have a friend or anyone who can give you some techniques or tips, that's kind of how I mastered it. There was a dentist that I knew and he just loved it. He loved to teach it. And so he taught me how to, master that. And I ended up really liking it. So once you know how to do it, you definitely will utilize that in dental school and in your career as a dentist. Sorry. So you want to do questions every single day, the questions on the case, whatever you're studying, and also the questions on perceptual ability. 1 second. If you can take over, Sherry, for just a second.
All right, guys, if you have any questions, be sure to leave them in the chat for Dr. Monica to answer them. I'll be reading all of your questions in the live session today.
All right, I'm back. Sorry about that.
Welcome
So,
back.
so those things are important. I always say that if you're still in class and you don't have good recommendation letters, try to get to know one of your professors really well. You can do that with office hours, but they're going to be writing you your strong recommendation letters. Those things are really good. You obviously want to do any shadowing that you can. And then when you're going to interview, you want to kind of put your best foot forward. If you are, try to make a little packet of things about yourself that you can leave with them, because most people are probably not going to do that. Just give them like a little, tiny little book or like a 1-page thing that you can write, maybe put your picture on it, just some things that kind of stand out about you, because once you get an interview for dental school, that means they like you. That means you're qualified. They just want to talk to you in person so they can see, okay, like, do we actually want this person? They look good on paper. Like, is this our people? Like, that's what they're really like looking for. So, and another, I think the one thing that a lot of people don't talk about is like your mindset. You really have to have a positive mindset. Like, yes, it is challenging. It's a lot of studying, but that is going to be your life for the rest of your life, because you think about getting to dental school. Once you get into school, that's all you're going to be doing. Eat, study, sleep, repeat. Like, that's your daily life. You're going to have to learn how to take the dental board exams, and then you have licensure exams, and then there's just always something that you will be studying for. So you just get that into your mind, embrace that, and just say, okay, well, you know what? Like, this is the beginning of my journey as like a lifelong student or a lifelong learner. You always want to be learning to be better, not better than anyone else, but better than your previous self. So if you have a positive mindset, because whatever you think that's going to become like what your habits are. Your habits then become your actions, and so on and so forth. So you really have to be positive and be in that positive mindset, so you can know, like, hey, I have this DAT coming, but I'm going to do well on this. I'm going to go and talk to, these people. I'm going to make it a point to accomplish all these things that I know that I can. Because if you get anxious, if you get really in a tizzy about it, it just ends up not really working out, or some type of stress. I mean, it's already stressful anyway, so you don't need to add on to that. But reach out to people that you see on Instagram, or that attend some of the schools that you want to attend. See if they have impression programs at their school, or if they can talk to you about their experience, or if you can actually visit them in dental school. Whatever you can do to get yourself one foot in that door, that's what you want to do. Be creative about it, but be genuine, because people can recognize that. So I feel like I have talked quite a bit. So Sherry, do you have any questions specifically that I didn't touch on?
If you don't mind, we can Can we ask you some questions that are in the chat?
Yeah.
Okay. Our first question is, do you have any tips on how to memorize large amount of information during dental school?
So what I did in dental school, instead of okay, like if it's like the beginning of the month and my test was not until the end of the month, instead of waiting until like that third week, and trying to cram all that information in that last week, like right before your exam, every single day you have a class, like just master those things that you learned that day. So whenever you're studying until like midnight or 1 a.m. in the morning, master those things that you've learned that day. And then that way, the next day you can just review what you did the day before. And then on that day, the next day, you can learn what you learned that day in class, and then review your other things. So you're always going to be building. If you wait to the last minute, it's always just going to be a stressful thing. And I think it's one of the things that most people struggle with going into dental school, is learning how to study. But you need a study group. You cannot study in dental school alone. It's not safe. It's just stressful, and it's better to disperse the stress amongst a group. And then there's always going to be someone who's stronger at one thing, and you'll be stronger at something else. So the best way to show yourself that you know something is to teach it to someone else. So if you feel like you've mastered something, say to your group, like, hey, let's go over this. I'm going to do this. This person explained this thing. And then, because we all have different ways of thinking about things. So that is a really, really important tool to use, like your classmates, because these people are going to be your family for the next 4 years and beyond. My classmates and I, we are still all really good friends. So, what are the other questions?
Thank you, Dr. Wheeler. So, another question that we have in the chat is, since you have already been through dental school, is there anything you would tell your past self that you would, maybe you want to do over, or maybe, some type of experience or something you could tell your past self that you know now that you didn't know back then?
Yes, that would be so. When I took my DAT, I studied really hard for it and I did well on it. So I just thought that I was just going to go into dental school and just be super amazing in it. And I wasn't. I really had to say, okay, I need to rethink some things and really adjust the way that I'm viewing this. So I think for me, it would be to just study harder, study in a different way, like the beginning of dental school. But I was always really active with a lot of different things. I worked in dental school for an orthodontist. I thought at one point I wanted to be an orthodontist, so I worked after. I was really involved with my professors. I was really involved in like campus activities. So I try to do research during the summer. All those things are really important. And I had at my school, we had a big sib who was from the class ahead of us. And so she kind of got guided. She's in the same sorority as I am. So she kind of guided me on some things of what I should be getting involved in, what I should be doing. So I was really grateful to have that. So I'm not sure when you do get into dental school, if you can just maybe, if you don't have that, they don't have that program where they match you with someone, maybe you can just reach out to someone in the class ahead of you to say, hey, what advice would you give me? Because every dental school is different. So that, I guess that would be different. Like, don't go into thinking, okay, I got this, because you don't have it.
Thank you, Dr. Wheeler, for answering the question. Another one is, how was your experience at your dental school?
My experience at dental school is actually pretty fun, to be honest with you. In college, I was always busy. I had 18 hours like every single semester. Although I was active in stuff with in college, I didn't really party in college necessarily. And being from New Orleans and going to college in New Orleans, people were like, how did that happen? But I was really focused on being a dentist. And when I got to dental school, it was just, we studied really, really hard, but we partied all together. Like, we kind of just shared our stress. And when someone was down in our class, like, we really kind of rallied around that person. We didn't want any of our classmates to not be in school, or we called it No Child Left Behind. Well, that was our motto, because we wanted everybody to matriculate through dental school all together. And I think we didn't have any casualties. Maybe one like person just dropped out of dental school. It's like, this is not for me. But I had a really good experience. It was hard. It was really, really hard. But my class was like a family, and my school was just very, it was just a really fun, positive place. Now, that's my experience. You can talk to some other people who went to the same school as I did, and they didn't have that experience. So I think it's what you make it. We also kind of made fun of our professors in a way that we didn't hate them. We just kind of like laughed at them, like, after hours, like, oh, that patient, that teacher is kind of a little crazy or whatever. We try to do whatever we could to stay like in good spirits. But I had a great experience. I had great patients. I had great experience in the clinic. There was nothing that I was lacking. I feel like in dental school, I got all the experiences that I needed to go out into the dental field when I graduated from dental school. For me, I always knew that I wanted to specialize in some capacity. So I opted to go to a residency program. And I also just wanted to be in a different area, learn different things from different people. So that was my experience at Meharry. And it was great. It was a great place. Love it.
Well, thank you, Dr. Wheeler. So, Our next question is an advice question, and they're asking, since they're a senior in high school right now and they have an interest in doing dental research with a professor, how would you suggest they get started?
I would say they should talk to the professor, express their interest, and then even if they're not getting paid or compensated for it, if it's something they really want to do, definitely go for it. I think it's great. I think dental research is it's always been big, but right now in America or just in the world, period, everything is about evidence based medicine, dentistry, just everything. So we all want to be doing research on okay, different case studies, like how is this drug affecting these different people? It's kind of just like the COVID vaccines, right? Like we don't know what's going to happen until we actually do the thing and then study what that outcome is. So I think that research is definitely the way to go. We definitely need more researchers. So I say whoever that is, like definitely go for it, push for it, and just even if you, like I said, it's sometimes it's not about am I going to get paid for this. Sometimes it's about the experience, and no one can take those experiences from you. And then you don't know who you can meet when you're doing these research things or when you're just kind of extending yourself. People see that you're genuinely interested, and then you don't know the person that you could be on the research project with could be the president of XYZ, or their brother could be on that missions committee in some dental school or work at whatever, other big pharma companies. So um, I say, like, don't let compensation be the rate limiting step for you. Just get out there, get into it if you want to, and you'll reap the benefit some way in the future.
Thank you so much, Dr. Monica, for your response. Another question is, what did you look in dental schools when you were applying?
So I looked for an HBCU because I'm an African American woman. I went to an HBCU for undergrad, and I knew that there were only two HBCUs. And for me, when I was in college, I knew that obviously I was going to dental school, but I was basically Hurricane Katrina came. It was my last year of college, and I was like just starting it, and so I was trying to figure out, like which dental school I wanted to go to. Was it going to be Meharry? Was it going to be Howard? Well, obviously Hurricane Katrina just kind of messed all that up. So I ended up going to DC. My mom's like, "Hey, get your stuff so you can go to Howard and see their dental school." I got to Howard and I was just like, "There's no windows in here. Like, there's no windows in this whole. It's like it was no windows." So because that I didn't want to go there, and I think had also associated with like Hurricane Katrina. And I went to Meharry, had a cousin who went to Meharry, and everybody was happy there. They had windows. It was just a cool place, and I felt like that's where I was supposed to be. So I looked at the minority schools. There's nothing wrong with them. Everybody takes the same national boards, so every dentist, no matter what school you go to, you're going to learn all the same things. Um, so that's what I looked for, and I'm glad I did. Everybody in my school was not black. We had different races in our class and in our school, but that's what I looked for. I looked for people who were happy, places where the students were happy, an environment that I felt like I could thrive in, and professors that were happy. So I saw a lot of people who looked like me, a lot of African American women, and that's why I chose Meharry. And I'm so glad that I did.
Awesome. Thank you. So another question we have here in the chat is, do you think that applying end of July decreases your chances of getting accepted into dental school?
I don't think so. I think that, first of all, I think what's meant for you is meant for you. But also, if you have a strong application, if you can provide something that someone else is not, I don't think that it's a bad thing. Like I said, I'm trying to remember. This was like so long ago. Like I've been out of school for 10 years, so I can't remember when I interviewed, but I know, was it in February or whatever, that I got my acceptance letter, and I'm like, okay, like I'm gonna go to Harry for dental school. And I got into Howard too, but I just didn't want to go to school there. So I don't think it decreases your chances. Now, if you don't have a strong application, I think the earlier you apply and the more schools you apply to is better, perhaps. I know for me, I only want to go to 2 schools, and so that's where I applied. Um, but like I said, if you have those requirements, if you are selling yourself through your personal statement and you get an interview, you're pretty much in school, and you just need to kind of seal the deal when you go for your interview.
Thank you.
Any other questions?
One last question. How do you deal with difficult patients?
Oh my goodness, it's great. I just wrote a protocol for my office on how to deal with difficult patients. I think with the difficult patients, sometimes it's not. Sometimes there's just people who have hard lives or difficult. They just are having a tough time. Like either they're going through a divorce, or they just lost a parent, or they, just lost a job, or they're having a tough time with their kids or something. Usually those are the difficult patients. So it's like they're just kind of projecting whatever they're going through onto you. With those patients, you have to just listen to them, just be nice. You never want to be mean to a patient, no matter what they say or what they do, because obviously you take the high road. You are the healthcare provider. And sometimes some people are just mean, grumpy people, and you just kind of have to meet them where they are with their energy. You can never go to a patient who is like not happy or difficult and just be like, hi, like I'm Dr. Wheeler, and what are you in for today? You kind of just have to match their tone. So if they're kind of sad, you just be like, hey, how's it going? Just, very low energy. And then you match them where they are energy wise, and you try to bring them up. But you always want to listen to them. You always want to ask them, how can I help you? Or what questions do you have for me? So you're putting the ball in their court. And instead of saying, can I help you? That's a yes or no question. You're saying, how can I help you? Or not, instead of saying, do you have questions? Because the answer is going to be yes or no. What questions do you have? Like almost like I'm opening this up to you for you to communicate with me, because I care about what you have to ask me, what you feel, what you have questions about. I want to make sure that you're comfortable. So as long as you are doing those things, even still with that, you will not ever make every single patient happy, and you have to just be okay with that. But at least you did the best that you could do, and you were the most caring that you could be in those situations. So it is challenging because, like I said, most of the patients that are coming in to see you, they don't want to see the dentist, so you can't just say, well, you need to floss your teeth and you need to brush your teeth. You kind of have to, like get them to talk about themselves a little bit. And once people do that, they kind of just let their guard down all the way. So everybody wants to talk about themselves. So you never want to go in and you're just talking about yourself. Well, I did this and I did that and I did this. No, ask the patient. So, are you going through any difficult times, or is there anything that you want to talk about? Or usually they'll come out and say it. And once they do, you've kind of got them where you can understand their feelings and then can go from there. That was a good question.
Thank you so much, Dr. Monica. It was a great session and great advice. I hope everyone on here learned something new, and that I'll be posting the post-session quiz in our GroupMe chat. We're going to have another live session in a week. So thank you all for joining us tonight with Dr. Monica. Again, thank you, Dr. Monica, for sharing wonderful cases and your honest advice. It's really appreciated.
Yes, good luck to everyone. And like I said, if you want to get my information from Sherry, you can, but I welcome any questions. If you're in the Raleigh-Durham area, you can feel free to contact me and possibly come in and shadow. Anything you guys need, I'm happy to help. But best wishes to everyone, because you don't need luck, because you'll be prepared. And study hard and pray harder.
Thank you, Dr. Monica, again for a great session tonight.
Alrighty.